both from CARE as well as for CSIS, I think that this is the kind of tour that hopefully will give people the understanding to take back to policymakers so that the kinds of programs that the U.S. government supports will really meet the needs of people in countries like this.
We have a special interest in looking at the maternal and child health issues, and so we're here today, and we hope we'll hear more about that from you. We're also looking at sort of the long-term issues around the sustainability, the kinds of investments that are being made in partnership with your government.
Yaani watu wako tofauti. Kuna wale wanazalia nyumbani na kuna wale wanaenda hospitali. Lakini inalingana na uwezo wa mtu. Kama mimi sina uwezo, mimi najikaza tu nisalie kwa nyumba.
Women who don't have skilled care or antenatal care are the women who end up being a statistic.
Can you imagine a pregnant woman on a bicycle
for 12 hours?
For 12 hours.
And that was the intervention. That rescue.
And it was too late for me to do anything, and the woman died.
Life is so fragile, and I actually emailed my wife after I was in the hospital, and I told her that we had to count our blessings because we had twins and it was a complicated pregnancy, but we had a hospital within a mile of our house.
It's important for me to learn as a person who's not a medical professional that it is possible for about 20% of the children who are born to HIV-positive mothers to be negative. And they have a set of protocols here to help promote that.
Kibera. It's said to be the largest slum in Africa. It is virtually devoid of any infrastructure. And in the midst of this 60-hectare or so plot of land live somewhere between 600,000 and 2 million people, among the most dire health conditions probably anywhere in the world.
You're most welcome to Tabitha Clinic. It's one of the most ultra-modern facilities within this particular region in Kibera.
Seeing it on the ground and walking through, talking to the people. We did a home visit that was amazing. A young woman that had just had a baby. We were doing a check-in with her, and they do these on a regular basis, and actually just seeing the new technologies that are being implemented in such a sad area is amazing.
I'm very happy to be here, and thank you for the work you're doing.
We are going to discuss the US-Kenya partnership on health, taking stock and charting the way forward.
First, I must appreciate the helping hand that the American government has given us in donor funding towards the healthcare program.
Looking back, I think it's important to acknowledge that the United States and Kenya have worked cooperatively in very important ways to promote health. The United States has a public health investment in Kenya of over $600 million.
65% of the people here live under $1 a day. And with the wealth we have in this world of ours, we ought to be able to share it a little bit better than that. There's some basics that everybody ought to be able to have.
Maternal mortality continues to be one of the most neglected health issues, and it's where we've made the least progress. What we need to do is to make sure that we're applying the things that we know can make a difference.
That includes access to family planning, access to skilled birth attendant, emergency obstetric care, and postpartum care for their newborns. What the U.S. can do is provide momentum and really provide leadership so that these interventions are mandated so that moms are no longer dying needlessly.
In the States, they say cheese, I think it's easy to sit in Washington and have some sense that you know what's going on in the world, but if you take a look at the faces around me here, you realize that there's a lot going on that you don't see every day.